Welcome. Glad to see folks are joining on here. I'm not sure, given that this is kind of the first day of the week after a holiday, I'm not sure how many folks will be joining this morning, but I'm happy to see you all here for sure. For anybody who might be new, I just want to mention my name is Stephanie Charrington. I am the Executive Director of the Backbone, the Eastside Pathways Partnership. And the Backbone you can think of as a staff of the partnership. And our role as the Backbone is to convene and facilitate and really drive a focus on data and communication so that we can get to our results. As we are starting out here, I want to just introduce the rest of our Backbone team. Sandy Nathan is one of our community impact managers. She will be facilitating today. Kalika Curry is also one of our community impact managers and normally facilitates this convening, but is not available today as she's in another set of meetings. We also have Peyton Richardson, who is our data officer, Joe Trotty, who is our communications manager. Thanks for the wave, Joe. And running things behind the scenes today is our business and operations manager, Vicki Yu. So I just want to do a very, very quick overview of the logistics today. Most folks already know this. I will mention you're starting to see people put into the chat your name, community, or organization with which you're affiliated, and your email address. That's really, really important because we have a roster that we share out so that you all can connect with each other. The chat gets very, very busy, so please continue to add in any questions or comments that you have into that chat. If you are, we definitely want people to unmute and share verbally. So if you're ready to do that, please make sure you unmute. If you're on the phone, *6. Be sure to take care of your needs, and all of this meeting will be recorded, as will the breakout groups be recorded and shared by the end of the day. So moving forward into Gracious Space, as many of you know already, Gracious Space is really the time for us to get our minds into the work we're about to do and to allow space for different voices who may not necessarily feel comfortable in a larger group to share. And so what we want to do is think about, especially in this time when there are so many barriers and obstacles, it seems like, we want to find the good or opportunities that are outside of maybe your comfort zone. And so your Gracious Space question to consider is, what do you do to shift your perspective and approach from seeing things as a barrier to seeing them as an opportunity? And we're going to have folks break out into groups of 3, as we have done in the past. You do not need to log off and log back in. By the power of Zoom, you'll automatically be sent into breakout groups. And then we're going to ask folks to come back and share 2 or 3 kind of ahas or learnings that you may have heard in your particular breakout groups. So, Vicki, if you can allow folks to get into their breakout groups and consider the question. Welcome, everybody. Welcome back. Hopefully you had a good discussion in your breakout groups. I want to just open up the floor and invite, 2 or 3 folks to share any ahas that you had in your breakout groups. Feel free to unmute or to share in the chat box.
Okay, Stephanie, this is Sue Baugh.
Thanks, Sue.
I was gonna, nobody else is saying anything, so I'll say something. I was thinking, lots of times, I'm an actual introvert, and lots of times it's hard for me even to make calls. We've talked about calling people and all that. And I just talk to myself, and I just say, you know what, you can do this, you can step up and you can do it. And that's one of the ways that I I changed the dynamic.
Yeah, that's awesome. That's great. I know, and Melissa, hopefully if it's okay, when Melissa was sharing in the larger group earlier, kind of the same thing. Sometimes it's hard to get out and talk to other people, especially if you haven't, that hasn't been a practice in that kind of co-development that we've talked a lot about in these calls. And if you're an introvert, that can be challenging sometimes to do
Yes,
that,
indeed.
to your point, Sue. So yeah, and I really appreciate you just saying, yep, you just gotta do it. We have people in our community who are suffering and they're left behind and left out, and we just have to make these changes. So I appreciate that. Any others?
Hi, this is Christy Mintier from W Schools Foundation. I was just saying, I think sometimes you have to go through a grief process and grieve your big ideas, your big plans that aren't going to happen. And once you can kind of get through that and get over that hump, then you can look at things with fresh eyes and do what can be done instead of worrying about what couldn't be done.
Yeah, that's great, Christy. Thank you so much. I appreciate that. I see Mandy also put in the chat, and I want to just lift up a few things in the chat, especially for anybody who might be on the phone. I know that you can't see. So seeing barriers as opportunities and focusing on solving the problems, a little bit of kind of what you were just saying, Christy, and having that grieving process, self-care, daily walks are also really, really important. Okay, I'm going to move on, and feel free again to continue to add into the chat. For those who joined a little late, if you haven't done so already, please include your name, community or organization with which you're affiliated, and your email address. Just a quick reminder, if anybody wants to opt out of being included on the roster, please direct message Joe Trotty on our team, and I'll make sure that your information is not included on that. All right, so the purpose for today, what we want to continue to do is get our minds ready to work in that container building. The container is this space. It's our platform here for working together. And we do that by the gracious space opportunity to connect with one another and hear people's voices. We also want to create some space for sharing our actions from our action commitments from our last call, as well as provide the opportunity for people to bring up things that are emergent issues that may not necessarily, you don't quite know if they fit into the 5 focus areas that we've talked about, but they're still important to our work. So we want to have that platform for sharing. We, of course, want to continue to look at our performance measures through data, and then we're going to be doing breakout groups in our focus areas, and continuing to diagnose the current state. And then, of course, out of that, make our next set of action commitments, which are really important, which help drive our work forward. I also want to just remind folks that we leave this platform open for about 15 minutes after the call, so that people can connect. It's not facilitated, but think of it as the room being left open after the meeting. You know, when you're in person, you're oftentimes saying hi to folks. This is your opportunity to do that. So we'll have it open for about 15 minutes after that. One of the things that we talked about several weeks ago was our visioning for improvements 6 months from now. 6 months seems like forever, especially given in the state that we're in. And that 6 months is about October. And we also recognize that folks are probably getting pretty weary. I know I'm getting pretty weary of being in shelter in place. This work is already really hard, and it makes it more difficult for me personally when we can't be face to face and with each other. But our collective work is more important now, probably more than ever, because of what we're experiencing as a community. And what I want to do is just provide a little bit of insight into what is happening behind the scenes. There is a method to this madness. There is a structure in terms of the phases that the backbone is taking all of us through. And I thought it would be helpful to kind of lay out a little bit of a pathway. And it's a bit of a call to action to stay in it together, because there are so many in our community who are in need. And the only way these changes are going to happen is when we individually take action and we come collectively together to move towards our results. So what you're seeing on the screen here, on the left-hand side, you guys have seen this if you've been on the calls. This is a high level of what we call the Equitable Results series. On the right is the actual format. You don't really need to know all that. That's our job as the backbone. I'm just wanting to share this with you so that you see that this really is a formal model. And the part in the yellow that you see on the left is where we are in that structure to get to results. So there are phases that we're going through to get to results. And then in terms of a pathway, a timeline, it's hard to say what's going to happen when. A lot of it depends on how people are taking action. And the most important thing to think about here is, we don't have a crystal ball, being the backbone. We don't have a crystal ball of when we're going to be able to be together or what's going to happen necessarily. But given that we had committed in terms of timing to calls through June 1st, actually June 2nd, which is next week already, we wanted to just give us the next chunk of time. And the backbone is committed to convening this group through August 1st. So that's kind of the timing. And then know that in that time, we'll be taking each of these participants, you all, through these phases of the Equitable Results series. So again, the whole purpose of really sharing this with you is to know that there is a pathway somewhat set up. And the request is for you to hang in there with us as we are doing this work on behalf of the community. Okay, let's move on here. I'm gonna, if you have any questions about that or any thoughts, please feel free to put any questions into the chat or unmute. So getting into the actual work, the first thing we always do now is talk about our action commitments that we made last time. And so I want to open up the forum and invite folks to unmute and share any actions that came up for you as it relates to prioritizing factors or even conversations that you had with those who are impacted. This is our opportunity to kind of see what's happening in the other groups and what people are doing. And so this is the chance to share with each other. If you don't have any specific actions, you can also share your experience with using the accountability pathway. So I am going to invite folks to unmute.
This is Cassandra. I can share what I shared, if that helps.
Awesome. That's great, Cassandra. I saw a lot of information going back and forth in email. So yeah, that'd be great.
We've been an active group for certain. I was able to share what the Lake Washington School District has gathered data-wise since the shutdown, basically, when schools were closed on we closed on the 11th of March. And where are all the gaps analysis that has been done by our district administrators. And it really does highlight, as we all know, what those gaps are, who is not able to access education right now, despite efforts to reach out. And I know teachers are actually making door-to-door visits to try and engage other students. Just find out, are you okay? Is there any other reason that we haven't been able to connect with you? But then other people in our group shared how, they polled Spanish-speaking parents and what are those why aren't you able to access, or what would make it easier to access education? So I will let the others chime in on that.
That's awesome. Thank you. And Cassandra, what you're exemplifying is, again, this whole idea of each individual taking action so that collectively we can create these equitable results. So thanks for sharing that. I appreciate it. Anybody else? So Cassandra was on the remote living and learning little focus group. Anybody else from that group want to share? There was a lot of activity going on in the email, or any of the other focus areas.
I'll try. I was also part of the distance learning group. And yes, we have had some really good email discussions. One of the things that came out, well, there were a couple of 3 themes, but one of them is the grading structure may have an inadvertent impact of demotivating students because A, are incomplete. Even highly motivated students are having a hard time getting motivated in this environment. And this was particularly highlighted in Liliana's mail about the critical nature of reaching out and helping parents engage. Some of that's language barriers, some of that's technology barriers. The person I spoke to was a teacher, and she thought a lot of it was a lot of email discussions, and that's not how people engage anymore. They use Instagram, they use YouTube. There's other tools that could be used, but definitely the language barrier and the parent training, parents feeling like they were thrown in and don't have the skill sets to do it. So those were some of the things that came out. And I see Liliana just joined us, so maybe she can speak better to that survey that she did. But yeah, those were a few of the things that came out.
That's great, Chris. Thank you. I really appreciate how you mentioned reaching out to other stakeholders. And I know, as you mentioned, Liliana also reached out to community for through a survey. So Liliana, do you want to share a little bit about that?
Yes. Hi everybody. Thank you very much for thinking about what I just shared. Yes, I shared this with a small group in Facebook, and that's what I found. I share it with people that is part of Lake Washington School District and people that is part of Renton and Linwood. Why I did that? Because I wanted to see if there was any difference. And indeed, I found that there are some parents, let's say in Lake Washington School District, the parents that are more involved are parents that are, let's say, that have certain level of education, right? So the ideal is more with not technology, but with a thing that for families that have more than one kid, they have, teachers have now the freedom to do it either way. So when they have more than one kid, they find that it's hard for them to keep track of each student's teachers about what to do. But from other sides, it's the other kind of things. People that really don't have the knowledge even to manage a computer, that they don't rely on email. They are not aware at all about the things that they should do to help their kids. And many actually, and I would say many out of the 40, but many were saying that the thing is that people from school expect us to know what to do when nobody has really explained to us what to do in Spanish. So for them, that was hard, because first was the thing that most of the communications were coming in English. And also is the assumption that even if it comes in Spanish, the school assume that parents understand what you really have to do. So some of the parents were saying it will be really good if maybe there will be like a Zoom conference to explain where to click, what to do, and how to understand, or how to translate this. Or if we have like a video for troubleshooting, for things that are easy to understand. There was a mom that was really frustrated because a teacher was so kind that she sent pictures for all the process, and she was super happy, but the teacher, let's say, left out the saving part, and mom helped her daughter to do all the job, but she didn't know how to save it, and she pretty much lost all the job that they did together for 2 hours. So that was very frustrated for her, and she was almost crying, asking for help. So those are the kind of things that we have found. And I asked them, what would you think that do you need to be able to be ready for fall if remote learning is still the way to go? And they said that maybe school can kind of help with the grades this year, but it's going to be hard for parents to help from the very beginning if we don't get any kind of training.
Mm-hmm.
So some parents already resolved the thing of getting the computers and the Wi-Fi, but still they don't know what to do and how to help their kids.
Yeah, thank you, Liliana, for sharing that. I think all of this is really fantastic insight, and I think it's particularly important for those who may not necessarily be thinking of yourselves in remote living and learning. The reality is right now we're all remote. And it is the opportunity to really take and hear what Liliana is offering and what others are offering and figure out how do you incorporate that into the work that you're doing. I do know, and maybe somebody up from the Bellevue School District is on as well, there's a forum, I think tomorrow, for the Latino Hispanic community. And there may be opportunities to think about what Liliana is offering in her action commitments and figuring out how you might be able to incorporate that into improving what is coming up tomorrow in the Bellevue School District's forum. There are a couple of things here too. I see Tom took an action commitment to connect with Marjorie about resources that will provide antibacterial infant toys to families. Super. Thank you, Tom. I appreciate that. It takes every little bit of action to move our work forward. So any other action commitments that folks want to offer?
Can I jump in real quick? This is Gargi Trishelle with the Bellevue School District.
Absolutely.
I just wanted to mention about the Wellness Forum for Spanish-speaking families tomorrow. And I think that would be actually a great opportunity for us to be able to incorporate some of the information that was just mentioned from Liliana. Our focus tomorrow is on health and wellness for families, and it's a live Teams presentation that we're doing, but we're also going to take it and then we're going to post it on Facebook, and I'm going to actually pass it on to Liliana to post also on the Lake Washington School District Facebook. And that way we can share the information. We have community partners from CMAR and Sound and Consejo and YES will also be participating along with district families or district staff, all in Spanish.
That's fantastic. Thank you. And great segue into our next few minutes here. I just want to open it up and allow folks to have the opportunity to share other things that are happening. I know there are a few things happening and being mentioned in the chat. HopeLink is sharing available resource information through school districts. And if you're a school district and you do not have the HopeLink resource information, please make sure to let Lindsay know. A few other things in here. Trying to keep up with the chat that's coming. Anybody want to unmute and share information? This is the open forum for that.
So this is Narima Amin with Global Social Business Partners.
Hi, Narima.
And I've been partnering up with an organization called Farmer Frog, and they have been in partnership with this organization called Food Rescue, and the East-West Food Rescue, actually. And they have been getting a lot of potatoes and onions from the from Eastern Washington area. That's, you know, that's what's going to be tossed, and it's in good condition, and they bring it over here, and at Farmer Frog site they're able to bag and deliver potatoes to school districts, food banks, and anyone else in need. So I just wanted to share that that's out there available to many people. Farmer Frog did not ask to be land in this situation, but here was the opportunity, and they stepped into it, and it's it turned out to be a lot of things that people want, and I just want to share it out there. So far, they have bagged 607,000 pounds of potatoes and distribute to over 70,000 families. And I just want to let you know that's out there and that's happening around food security.
That is great, Narima. Thank you. Would you be willing to put in the chat where folks could get additional information on locations for that, or if they have any questions?
Sure, absolutely. Thank you so much. Yeah,
Thanks, Narima. Any other items to share with the group?
Stephanie?
Yeah. Hi, Judy.
Hi, it's Judy Buckmaster from the Bellevue School District. Lots of questions are starting to come up around what summer meal programs are going to look like. And just to update everyone, we're all school districts are waiting to get waivers from the feds, because as of right now, we will only be able to offer what our regular summer meal program would be. And for the Bellevue School District, for instance, that would limit us to 2 sites, which would be Sammamish High School and Lake Hills Elementary, as opposed to the 40 sites that we're now serving at. So that would be a huge change for the community. And that's our normal summer feeding program. So until we get some leeway from the federal government, that's what we're going to be left with. And so we're all waiting. And I will provide updates as soon as we know anything.
That's great. Good to know, Judy. I appreciate that. I also see in the chat that the City of Kirkland is partnering with YES to offer weekly groups for teens, and there's a link there. And also there is the Seattle Foundation COVID-19 Response Fund that was announced, next phase of funding. So want to make sure that folks apply for that funding, and the grant applications are due May 29th. Thanks, Kathy, for including that. She included the link in there. Any other items for folks to share in this open forum? Okay, we're going to move on. Just a reminder that you'll have the 15 minutes after to connect with each other, and then of course you can connect with folks individually through their emails that will be provided as well. Thanks everybody for that. I am now going to turn it over to performance measures with Peyton.
Thank you, Stephanie, and thank you all for continuing along this work. Just a brief preview of what we're going to do today in this data section. We're going to move through the 2x2 performance measures grid and look at an updated egg chart to really focus on the focus populations. And then we're going to ask a few questions to check our progress in this during these collective meetings, and make sure that we in the backbone are taking into account your experiences. So here we have, again, our performance measure grid. And as part of the equitable results series that Stephanie talked about a little bit, this is an example of how we all are doing our work, how the backbone does its work. But this 2x2 performance grid really here is again, represents the partnership's collective work. And we've seen it a number of times here. And what we want to do is continue to update for you the work that you all are doing, and the work that the Backbone can show back to you. So just a quick review of some of the updates here on this collective 2x2 performance measure grid. Over in the bottom right quadrant, the better off quadrant, we wanted to put a number next to that 100%. So that number, again, represents the number of East King County residents that we're approximating when we say that 100% need to have the support to reach the universal population goal. And down at the bottom there, you'll see the cities, the areas that are included when we say East King County residents. And moving to the left, you see on the lower left, the difference made. And what is circled is really the work that you all have done over the past 2 weeks. These are the current state, the approximations that you have provided. There are still some that I know folks are working out, but we want to make sure that we recognize that this is going to continue to populate. And again, these baselines are going to serve really as a benchmark of your efforts that you're making to continue to kind of push the envelope and make sure that there are system level changes, and these are going to be, like it says there, really indicators of those changes. So how much are we moving the needle against this benchmark of current state? And in the upper right hand corner, I'm going to quickly touch on this, and I'm going to tag Sandy in to speak a little bit about this. But the upper right hand corner, the kind of the how well area, this for the Backbone, this gives the Backbone insight on your experience during these calls. So validating the Backbone's observations with the polls that we're giving you, and how we're tracking retention on the calls, the attendance on the calls, where folks are dropping off, how comfortable they feel speaking. Again, all of these are areas of validation for the Backbone's observation, so that we know how we are doing and how your experience on these calls has been. So I want to give Sandy an opportunity to speak a little bit more about this, specifically this how well section as it relates to the work that we're doing. Sandy?
Super, Peyton, thanks. So in addition to how this quadrant serves the Backbone in convening you and bringing you together, it's also great to see the work that you're doing being populated into these quadrants. As we are moving into the validation of factors in our focus areas, this is really a foreshadow. So we are excited to get the data back from you, everything that you're learning from your validation efforts being populated in the how well. So really, I'd like to take a moment to thank you for showing up and moving this collective work and staying accountable on your action commitments. Because for this, how well is the data that you're collecting from reaching out to the impacted audience and learning about what they think about the factors and how they would like it to be prioritized, so you can focus on what you need to solve for in these calls. Back to you, Peyton.
Thank you, Sandy. And so the last quadrant that we really didn't speak about is this top left quadrant, the how much you do. And this is really going to be a list of kind of the actions that you're taking in your focus areas. And I know that we do keep reviewing this performance measurement 2x2 at this collective level. And just another reminder that these will be really, really critical for the focus areas, and that you're going through the factor analysis and going through validation and really fulfilling action commitments will allow you to fill out this performance measure 2x2 with performance measures that are really specific to your focus area. So again, this is at the collective level. This is all of our work, but as we move into those specific areas and as we go beyond factor analysis, you all will be filling this out with the result statements and then your baselines and indicators of how well, and also those indicators of all of the things that you are doing to begin to move the needle forward. So that is really what we're looking for on this performance measurement 2x2. Now, the next thing we're going to talk about is the egg chart. So we've seen this before, and I saw on the chart there was a lot about data disaggregation. So one thing I want to speak about at the jump is there is a missing population here. We have that I wanted to call out. Within the system and the agency population, folks under 65 with disabilities and students in special need. Those are definitely focus populations. They're not listed here on this chart, but those are focus populations to keep in mind as we look at our focus areas. But the reason that I want to put this egg chart up here is because we want to understand the connection between the whole population and the subset populations that we see here. And it's really going to help you understand the scope and the scale of your work and its relationship to the population level impact that you want to achieve. So again, these are the egg charts we've seen before. The numbers are a little updated because we've broadened the population a bit, but starting with the whole population of King County and then drilling down to the system population. And these are cities and areas that we've defined as East King County. And then drilling down to our agency population, and you'll notice we have 4 school districts, more than the usual 2, Bellevue, Issaquah, Lake Washington, and North Shore. And again, these numbers will be on the slide for you to review. But again, this is really an exercise in how we are really beginning to drill down into, from the entire county, into areas that you all have more direct, that you work with more directly and that you have a little bit greater of an impact on. And so going from whole, which is King County, to system, which is East King County, and then drilling down even further to the agency, the one thing that we want to make sure to additionally do is keep drilling down further. So on this next slide, we have program populations. These are a list of focus populations that were taken from the focus areas that you all wrote down. So out of the 5 focus areas that you all chose, these are the focus populations from those areas. And I'm not listing exactly where they came from, but you will know what your focus area is looking at. But the key here is that one focus population does not equal, only one focus area. There are a number of focus populations, immigrant populations, DACA youth, undocumented individuals that really do span the focus areas. And I think it's important to recognize that as we continue to do this work, these populations are impacted in many different ways. And that's evident as each of you chose some of these focus populations. Another thing you'll see is a general lack of numbers on this slide. And that's because I'm going to ask you, to take action commitments, and whether you want to throw it in the chat box right now or write it down, think about how you can get this data, talk to someone in your organization or in your community to get this data, or speak to impacted populations and gather this data. We at the Backbone want to make sure that we are collecting the data that you are providing so that we can continue to update this slide. We have a data folder. The link is there at the bottom, and it'll be part of the PDFs later. But we really want you all to kind of take that action to figure out if this is the focus population that you have identified. What are their numbers? How many of this population exist in East King County, or in King County, or in a specific school district boundary? Whatever it is that you're working on, I want to make sure that you have the opportunity and kind of the agency to really look for these numbers, whether it's in documents, or again looking at someone in your organization, your own information, or going to ask some of these impacted populations. These numbers are numbers that you all will be providing to us, and we want to have this continued to be updated. These numbers might not all appear next week. They may change, but really this is the work that you all are going to be doing, to grab some of these numbers so that you have an understanding of the depth of gaps and the area where there are disparities, and how many individuals would be experiencing these disparities in quote unquote normal times, and especially now during this COVID crisis. So these are going to be numbers that we're going to look to you all to fill in, so that we can throw these up in the coming weeks and make sure that we have a good reminder of those different populations in our community that need to be served. So on the next slide, Vicky's going to throw up a research poll. Again, we are looking to continue to understand exactly all the things that are happening on these calls and with you all. So I'm going to give you all maybe 2 or 3 minutes to go through these 4 questions and provide us here at the Backbone with an understanding of how you're experiencing it, and additionally your desire to continue this work with us. So I'm going to give you maybe about 3 to 4 minutes to really answer these questions, and then we're going to move forward. All right, I think we have a good amount. I know there was a question about the polls being open-ended. Some open-ended questions, and that is actually a limitation of the Zoom functionality. We would certainly love to have more open-ended questions, but the reason we're not asking is because Zoom doesn't allow for open-ended answers from the respondents right now. I'm going to move us forward. So I'm going to end the poll and hand it off to Sandy, who's going to lead us through a few more aspects of the Equitable Results series before we go into our breakout groups.
Super, thanks, Peyton. Hey everyone, I'm Sandy, and I will be facilitating the Equitable Results series for you all today. Just a quick preview of what we are going to be doing in this section. You have already worked on, identified the universal population and a couple of your focus population in the 5 focus areas that you all self-selected into. You also worked on factor analysis for the universal population and collectively agreed on 1 focus population to do factor analysis on. Today we'll be talking about how can you leverage your relationships to validate and prioritize the factors, because as we know, the focus population many times are not in these rooms. So it's really, that is a real critical step in the ERS series, to be able to speak to the focus population to validate and prioritize on factors as you think of what you need to develop strategies on. And then, as usual, I will be sharing the toolkit review with you. Right at the beginning of this meeting, Stephanie kind of walked us through the ERS roadmap and the sequence of activities. I would like to take a couple of moments to talk about the journey that we have taken on these calls, keeping the ERS lens on. And I will do that by providing a really simple example. So when we started on these calls, we really spoke about the needs, the emergent needs and the resources that were available. So really the technical, the known space. So we were all in a known space, and that is really important in the time of crisis. So for example, we realized that there was a need for 50 shoes, and we had providers on the calls that said that they could make those resources available. As we moved along, we learned that 32 of the people who needed shoes, their needs were met. We still had those 18 whose needs weren't met. So that was a gap. When we diagnosed further, we realized, and now if you realize we're moving from the known to the unknown space, when we diagnosed further, we realized that those 18 who had not gotten the resources, the reasons could be that they had leather allergy, and these shoes were made out of leather maybe, or that they needed a different type of shoe which needed some accommodations given the condition of their feet. So what I'm really trying to say is validation of these factors is important to diagnose any blind spots that we may have. And to really know that in order to move this work collectively, we need to really work with the focus population, those that are the closest to the results and those that are most impacted. If you look at the left-hand side, the universal result, the focus population result, the core indicator, current state, and the key factors, that's the phase that we are in now. And then we will be going out, taking action commitments to go out and validate, and then move into the strategies and the tactics phase, which is to say, which of these factors have been validated by the impacted audience, and they prioritize that as emergent, which we can collectively look at strategies and tactics for, and then performance measures. So this sequence really centers racial equity, by using data to ground the work and collaborating with the impacted audience. Can we go to the next slide, please, Joe? I really love this quote from Vince Lombardi: individual commitment to a group effort, that is what makes a team work, a company work, a society work, and a civilization work. I would like to take a moment to really thank each of you for sticking on and trusting the process. Every time that you join us on these calls, we are disrupting status quo and really building relationships that can change the outcomes for our community. So today, as we move into our breakout groups, I really want each of us to think about, how does my action impact our collective work? How can you get innovative to really think about what does going out and talking to the focus population look like? Think about the gracious space that you experienced. How are you taking, what does looking at these obstacles and turning them into opportunity look like? With that, we're going to be broken into our focus area breakout rooms. Vicky's going to help us do that. You don't have to do anything really. You'll move into your breakouts, and today you'll really be reflecting on the factor analysis that you've done. In some groups haven't come up with a baseline, so you're going to be taking care of that. And then think about what action commitment can you drive in your role as a part of your organization or as a member of the community, to really reach out to the focus population and validate and prioritize these factors. And we have 5 focus area groups here. I want to thank Kathy here because she stepped in to facilitate the funding breakout as Stephanie moves into the remote living and learning breakout because Kalika couldn't join us on this call today. So Vicky, could you please move us into our breakout rooms? Each of us will have 20 minutes. And when you come back, I will invite a few of you to share your action commitments so you can stay accountable and we can help keep each other accountable. So thank you and have a good breakout.
Set a recording here and I'm going to share my screen. And as I'm doing that, I'm wondering if one of you, when we go back, would be willing to share action commitments that come out of this. So everybody in the room can share. Can you guys see my screen now?
Mm-hmm.
Okay, great. Anybody willing to be our spokesperson to share action commitments?
I already talked. You guys need to step up. Be brave.
Thanks, Cassandra. Anybody can share. Just 1 or 2 action commitments. That's all it is that come out of this. Jamie, I see you. I know you're not shy.
Yeah, no, I was trying to figure out how to unmute because now it's in a different screen and I was like, where is the unmute? Yes, I can take some very, very loose notes to talk about.
And again, the only thing is that we just want to share 1 or 2 action commitments. That's it.
Okay. Okay.
Super fast at the end. Okay. So I just want to start with the action commitments that we took in this group last time. And I don't see Gloria on today. I'm kind of scrolling through. Gloria, you're not on? Okay. So I'm not sure if the information in the data. Say that again. Oh, had some interference. Cassandra, I know that you shared your action commitment and the breakdown. So do you have the actual breakdown by age and the demographics?
I don't see it by age. It's by grade level right now. And sometimes it's, if we look at other factors, it's first grade and, 2nd through 4th grade. And there's nothing that's actual chronologic age.
Mm-hmm. Anything by demographics?
Yes. I'm not sure if you were able to read the report that I sent, but it's special needs is broken out, EL is broken out. I don't think it's, no, I think even gender can be broken out. Ethnicities are broken out. Low income is broken out.
Awesome.
Yeah.
That's great. Thank you so much. Just so you guys know, what we'll do as stuff comes in, and when Kalika's back too, we'll start compiling this information into the data folder specifically for remote living and learning. So thank you so much for that. I really appreciate it. This is where we're going to continue to capture action commitments. And we'll just step through this because one of our action commitments as a group is to go back and validate some of the factors that we've discussed already, that you've discussed in this group, both for the universal population, like what's driving that number down and what's driving the number up. Here they are. And then this group, you all also talked about the no online engagement, specifically, Cassandra, what you were speaking about. And I know that there was some conversation about some of those factors online via email. Are there any other factors or any other input based on conversations that you've had that is not captured in the document as it is right now related to factors?
Oh, I'm sure there's all sorts of stuff that I could have attached and did not. I will say that just in the conversation today, made me realize we have done some videos in Spanish about how to access education and some other types of trainings for parents who are in particular Spanish speakers. So I've just asked for where are those located, because obviously they're either not doing the job or they're not getting to the audience. People don't know how to access them, or it's not helpful enough. So I want to see what can be tweaked there.
Hello, this is Benjamin from BSD, Bellevue School District. And
Benjamin?
Yes, hi.
Hi, Benjamin.
Hi. So I wasn't here last week, so I decided to be part of this group, and I'm a newcomer. So bear with me, probably you guys discuss about this, but one of the things that we see in Bellevue School District is maybe as you do remote learning is the space. You know, there is students that have accommodated space for studying. That means they're silent, they have screens, they have the right tools. While there's other students that don't, right? They probably live in one studio apartment, and there's probably smaller siblings, or the mom is cooking and stuff, those things that may interrupt instruction. So just having that a matter of space. In that kind of same line, there's some students that, because their parents are essential workers, they have to be the ones taking care of their smaller siblings because of childcare needs. So the expectation for them is to be students / babysitters or childcare providers. So it's also hard for them to do this at the same time. So yeah, a couple of things that maybe can be part of this discussion.
That's great, Benjamin. Thank you. And one thing I'm noticing on the focus population, so we're estimating, well, not estimating, this is from Cassandra, this is the 1,800 number that you shared, I think, that 3.8% are not engaging online. And
I think it's about 1,000.
About 1,000, so the 1,811 is not correct?
That is not, unless I did the math completely wrong, 1,811 is not correct.
Okay, I'm going to say approximately.
Sure.
1,000. And on this grid, ideally, what you'd want is that number to be lower.
Absolutely.
Right? And so those factors would be reversed. Because we want the factors up above right now pushing that number down are the things that are actually adding to increasing the number. So I just wanted to note that, and we'll get that corrected. Thanks, Benjamin, for adding that. Any other factors or input that has come up through conversations that you've had with those populations impacted?
I just want to say, sort of following up on what Cassandra was saying, and maybe Liliana can help us out from her survey, but I know when I looked at the Lake Washington School District website yesterday, there were videos like in Spanish, but you had to access them through the Lake Washington School District. And I don't know if that's a barrier or if because it's too word dense or it's not in Spanish to get, when you look at the website, it's all in English.
Right.
So using those alternative means that Cassandra referred about, I think could be really key. I know YouTube is really controversial in education circles because they collect data. I noticed that Liliana was using Facebook for her survey. So if we could do some co-creation and validation with those families and figure out exactly what needs to be done to reach them in a way that they can access the data, I think might be really helpful in helping those families get their students engaged.
Yeah.
I hear an action commitment in that. Somebody willing to help?
I'll just mention that we do publish in Spanish on Facebook, Instagram, and Twitter, but that might not be what people need right now. I mean, maybe we need to ask Univision to consider doing an outreach, or, you know, I'm not sure we have funding to go run ads on television, but there's got to be some other way.
Hi, this is Liliana. I know that the school district was running a campaign and that was something that we asked, if the people could get information via text, because not everybody is maybe with technology, at least understand, right? And if it's in Spanish that says just click here to get this video in Spanish is going to be helpful. We run a campaign on Padres Unidos, but I never, and actually that was something that I was going to ask Shannon and Matt to see if they have the results about how many people actually registered to do it, because the way that it's working is not that the district is sending a text saying reply yes or no. Is a parents' initiative to do it. So parents had to go and do the first step, and then you will get it. But this is something else that I really need to talk to them, because I sign up myself to test the text messages. I sign up and I haven't received anything at all. Nothing. Every single thing is still coming through email. You are right. There are only one video that they made actually last week about Tower School Learning, because we asked about it and about Skyward. There's only one video done so far, or at least shared, and that went through email. Again, it's not going to the people. With Padres Unidos, we had a tutorial for Microsoft Teams, and that was very well taken by parents. They were engaged. It was a good thing. So, and about Facebook, that's something that I talked with Redmond Middle School principal, and I said, North Shore, it's going live every single day on their Facebook page, and they have a link as soon as they go up. If you want to translate this in your own language, so any language, you just have to click here. And I think that if somebody does that every day with enough promotion, Padres Unidos could help with that on the Spanish-speaking families. But also, I think that there's a different channel. That's the thing. It should be a different channel, because it's not just Latinos, are also people from Brazil that is being left out. It's a lot of families that are not English speaking that are left out. So I think that the problem is not that the district is not having communications, it's just not having the right channel to communicate. I think that's what it is. And also, as Benjamin said it very good, there's a lot of other social issues that parents are dealing with right now, when school and all the complications is just too much for them to be dealing with right now.
Would you be able to send us how to connect with Paros Unidos? Is that what you called it?
Yes. Yes, I can send you the email address that we are having right now, and that's the group that we work with and that we communicate with Matt and Shannon and Gloria to help parents. So yes, I'm going to send you via chat the email address for Paros Unidos.
And you're right. We have 119 languages.
It's a lot. Okay, thank you.
I'd also like to just say that I've had the same experience with my families with BelPres Kid Reach, where the best communication tool is the text messages. And you know, a couple different things happen. It's easier for them to respond. And sometimes if they have difficulty saying it in English, they can say it in Spanish, and I can use Google Translate. And so we have a deeper, better conversation that's kind of in real time. But I have found that that works. It's far more effective than email or phone calls or any other communication tool that I have tried. Text messaging is by far more effective.
So, barrier question. We have to have permission in order to text message people. So, would everybody think about that and figure out how we can get them the message that we need their permission to message them?
Yeah, with my program, right in the application, they consent right out of the gate. So I just have it.
In my case, as I said, I sign up myself to test the system, and I still don't get any message. So my point is, we push really hard on this text message campaign, but it's not worth it if the district is still not putting in action, or if it's, I know is tied either with Skyward or Power School Learning. I don't know what is the glitch, but I'm not receiving anything via text.
I had the same thing actually happen to me. And so I have to resubmit, please text me.
Yeah, and I understand that you need the permission for parents, but maybe when parents are registering kids, that could be an option. Is it okay to send you text so they can just check right away there? And when the registrars are doing the registration, there could be just a column that already like authorize it.
Yeah, it is on registration forms. So maybe it's the issue of it's not actually going out. So I'll double check.
Thanks, Cassandra, for taking that action commitment to check. Is there anybody on from Bellevue School District as well who can just check into the texting operation?
I got it.
Is that Shamari?
Shamari. Yeah.
Thanks, Shamari.
We have explored the opportunity, as someone said, there's a permission challenge, you know, federally, by law, we cannot just without any permission send text messages to folks. And so we actually have to launch a campaign in order to get people text message savvy, but approved. But also we're looking at another system called Talking Points. So if any of you all want to look up the app Talking Points on your cell phones, it is a dynamic way that we can translate information. So someone from our team can send a text message that presents to us in English, but we can say what language we want to translate it into. So the recipient will be able to receive it in their language and then respond to it in their language, and we'll receive it in English. So there are some new strategies that we're looking into that are going to be very helpful for us in the future. The challenge that we're facing is it just isn't helpful right now. And so I'll continue to do some follow-up. As someone stated, this really is a registration issue. You know, it's on our registration forms. It's never been pushed as a registration box to check, but we need to start as we are entering into this registration time frame right now for next year's school year to start pushing that agenda. And so we'll continue to work through that.
Hey, Shamari, can
Yes, ma'am.
anybody kind of download Talking Point and kind of play around
Yeah.
with it?
It's free. It's a free app you can download. You know, of course, the free app version has its limitations. We as an organization can't download the free one because we're going to use it in a mass amount. And so we're purchasing it for our organization so that ITCLs and teachers and other staff and people who counselors, people who communicate with families regularly, who have varying languages, will be able to communicate more effectively. So yes.
And Shamari, thank you for that. I appreciate it. Just one thought, I'm wondering how and who you're partnering with, especially for those populations that are frequently missed, in developing that solution.
Communications department. And so they have been really doing a bunch of the research as to how to ensure that we can get our text message strategies on board. And they've been working with other folks within our organization to try to push an agenda, but it's been a little complicated the past few times that we've done so. And so we know that by the end of this school year, which is only in 2 weeks, 3 weeks, we won't have the solution, but it's something we're going to strive to push forward towards the summer.
Lisa, I see your hand up. Thank you. I just wanted to finish up. Shamari, I'm going to ask if you can, if you'd be willing to take the action commitment to check in with the communications department that they're not developing that in isolation and are co-developing that solution with populations served.
Sure, I certainly will. Yes, ma'am.
Thank you. All right, Lisa, thanks for your patience.
Sure. I am wondering if a part of the solution to getting the parents' permission would be to reach out to places like HopeLink and other organizations that serve some of the populations where texting just works better because it just does, to let them send the word out to their people, the people they serve, via text message saying that the school will do this if you get permission from the school and a little bit of information about how they give the school permission, because then the school wouldn't be texting them, but someone else who already has permission to text them is making them aware via text.
So Lisa, what you're suggesting is let's utilize expertise from those groups that are already doing that. Do we have anybody on from HopeLink? I'm scrolling through our little list.
I am. Hi everyone. I'm Miriam. I'm the director of EDI at HopeLink.
Awesome. Hi.
Hello, hello. Yeah, that's a really great idea. I know one of the things that we've been thinking about, just in terms of making sure that people get information, is thinking about how we can use like our food bank, right? Are there flyers from different organizations that have really valuable information that folks need, that we can stick in with their food bank box that they get. So I could totally see a world in which if text messaging is an option, there's that, but also, how can we make sure that folks are getting that information in a variety of different avenues?
So Mariama, can I ask if you'd be willing to either send information or connect in with Cassandra and Shamari, just with any tips, advice, processes that you might have that they can consider that would be helpful?
Yeah, absolutely.
Thank you. And you should have access to their contact information.
Yeah.
Lisa, I saw your hand go up again.
Would it be an overlink? One of the members of the Bell Press Kid Reach Advisory Leadership Team is an employee of HopeLink, to reach out to her and ask her for strategies that she might be able to do, or would that be overlap for me to also do that?
So maybe the connection is, I don't know who the person is, Lisa, that you're chatting about. Maybe Mariama knows that person.
Netta Bandowski.
I don't know her, but I can certainly connect with her.
Yeah, I'm not sure exactly what role she has at HopeLink, but I do note that she has a role there, and she's constantly giving us information about services and ways that HopeLink can help families. but I don't know exactly what her role is there.
Yeah,
Gotcha.
so Lisa, one of the things we often see, especially in larger organizations like HopeLink, like they may not know each other, as we just saw. So
Yeah.
it's always, you know, at this point, it's better to over communicate than under communicate.
Okay.
So if you would be willing to reach out to that person to have them.
I will make that.
Recording. Okay, there we go. Recording now. So one thing that I wanted to make sure that we did, I think we did a lot of really good work last week in both clarifying the definition and having a shared understanding, and kind of getting to the, you know, speaking about our current state, which is we think that about below 50% of East King County residents have access to health and wellness supports that are necessary to survive through this time. As we move forward, I wanted us to really think about what we have. We have 4 focus populations here. And I wanted us to really hone in on one of those focus populations so that we can actually begin to look at the factors that are driving it down and driving it up. Sorry, driving the current state down or up related to that one focus population, so that we might be able to move forward with some action commitments. And I think that that would be really, really helpful to start right now with. So I'm going to turn that over to you all to figure out which of these 4, and I will highlight this because we want to look at the revision here. I think that's not a good idea. Which of these 4 do we feel are going to be, do we want to really, really start with and dig into? Obviously, each of them is important, but we have limited time, and I want to make sure that we can get started on moving the work forward. And I do think that for a lot of these populations, they're not going to be the same action commitments and the same solutions, but some solutions may drive the work for other focus populations as well. So are there any focus populations that you all feel are that you'd like to really start with as we kind of dig into looking at the factor analysis and working towards solutions?
One area that I've tried to reach out to and I need to follow up with again is LifeWire with domestic violence, because and I haven't been able to connect with yet. I don't know if you have a good person, Peyton. But I know Westminster, one of the things we're wanting to do is help support those who are needing help in this time with domestic violence and child abuse. So, and that is one thing we've talked about as a team with the mental health at Westminster, is this need that we're wondering just how it's going to explode as people come more and more out of their homes and we hear the stories. So that is one area that we're trying to tap into a little bit more.
Can I ask a quick clarifying question? Are we going to eventually get to all of these populations, or do we just have to pick one now?
Ideally, we're going to get to all of these populations.
Okay.
I wanted to pick one so we could kind of get our feet on the ground and get started. But yeah, we're gonna do all of them, but I just want to start with one right now.
I'm a little bit worried that each of us has a pet project,
right.
like that, you know, like childcare is my life right now. So, you know, like I would obviously put that forward and as like 25% of the voting population, excluding you, Peyton, it would be like, we'd all probably surface all of our varied interests. So.
Right. And
I'm wondering if we just don't start with population 1 and just work our way through.
That we can do. I'll also throw another thing in here. Because I think there is such a varied areas of expertise and content expertise in this small group. And we also talked about last week how this is a unique situation because this is not an immediate fix. Not that food and housing are easy, but they're a little bit more technical. This is a much more gradual and longitudinal area. So we can start at one and work our way down, or we can really, you know, each of us hangs onto a single focus population and moves forward that way. If you feel that is a better way to get your action commitments and and start moving that work forward. Really, it's up to you all. And if you would rather go to that focused population where you have either, you know, lived experience or content expertise, that's great too. Or we can start at the top and go down. Really, it's whatever is going to, I guess, move the action and move solutions quicker. And if you already have, you know, like Corey said, if you're already working in that area, it's probably a good idea that, you know, we don't all have to be in the same area. So I am open to whatever you all want to do. I just want to facilitate and, you know, facilitate towards action, but however you plan to take it, whatever's best for you all.
And that's a great point, Corey, because we do all have areas that we know more about or less. So.
And I think that if we choose to do that, I think everyone's perspective is certainly valid to speak to each focus population, but perhaps then whoever feels that focus population is closest to their lived experience and or work takes the action commitment to move that work forward. You know, takes the suggestions, takes the multiple perspectives and things of that nature. If that is going to be better for you all, I know that obviously there's a lot of stuff going on for each of you outside of these calls, a ton going on outside of these calls. So if we can streamline this with that work, that might be the best solution.
Yeah, and just, all of these are really gnarly problems. So I'm thinking that, you know, maybe just starting with number 1 and moving down and using that one as a example, because I'm perfectly happy to fill in the childcare one, and then on our next meeting we can come back and sort of go over what we each put in. I'm just not sure that, you know, like I used to offer, you know, work on telemedicine services for genetic counseling, but that's, you know, that's the limit of my knowledge of that service.
Right.
But, you know, I'd love to learn more.
Right.
Well, and Peyton, I wonder with this focused population, you have telemedicine and you also have, I don't know if that's just if you're looking at, you know, doctor appointments or if you're also looking at counseling. And those are two different, you know, that's part of your health and well-being. There are people who are actively, I mean, I recently did appointment via telemedicine, but I have technology. So how do we measure it? I know people in the counseling realm who are doing counseling on, you know, different technological, you know, venues, and some, because they're now considered essential, can do in person as well. But again, how do we measure it? How do we find out access? Where do we begin with that? Because that is so varied. You've got a lot of people in private practice, hospitals. Are they going to want to give out, you know, information? So how do we measure that?
And I would offer that, that's a really good point. And I would offer that the definition of telemedicine services really can be something that we clarify. And I think that it can be something that we clarify. And I do think that we would have to, because there are laws, you know, there are HIPAA laws, and we're not looking at for patient names and really possibly demographics, but possibly just numbers of, you know, or how many, and this can be the work that you all do, but how many individuals are receiving telemedicine services now versus before? Like, has this current remote situation changed or drastically reduced or increased the amount of appointments that are being sought after? But I think it does span both, obviously, strictly physical health and emotional health and social well-being. But I don't want to define it for you all, but I would keep that definition pretty
because
open.
even this morning there was an article coming out that 4,000 people between Harborview and UW, nurses and stuff, have been furloughed. So people are not doing on-site appointments. They're not doing, I know people who have been told, you know, their cancer treatments are delayed. So yeah. So how do you know, it's a very convoluted thing to try and measure. More people are doing telemedicine, but is it effective?
Right. And I think that everything that we're saying, and I should be writing this down, these are actually, you know, factors kind of driving it down. One that you mentioned is that fewer medical staff on site to handle these telemedicine appointments
Yeah, because they're having to furlough because the patients aren't coming in, and so the hospitals are having to balance their budgets. You know, I know I have people I know at multiple hospitals, people I know that work there, and furloughs are huge right now. So, but that doesn't mean more people are doing telemedicine unless they are savvy enough, or some people are just delaying their health.
Right.
I also think there's like silly things like bandwidth on the internet. So like not even access to the internet, but bandwidth. You know how hard it is for us to get it on these Zoom calls when you have 4 other people in the house also on Zoom calls.
Right.
A newer Melissa, what do you know with these areas?
For me, I mean, our organization helps the community in different ways. And so we're bringing mental health awareness and work with kids. But as far as East King County, what we find is for data purposes, everyone is put into the Asian category. It's a huge difference, and there are so many different languages. And so as we're hoping that's getting segregated a little bit, where, you know, East Indians, for example, are the second largest population in Bellevue, and in Redmond, out of the Asians, and the first one. And so but the data does not reflect that. And so as a community organization, that is tough as well, even though we don't base it on demographics or ethnicity to that extent, but when we're looking at data, it's very difficult to evaluate those things.
No, I think that's a really good delta there to the lack of that kind of demographic disaggregation. And do any of us know, is that an issue of it not being collected, or I'm curious whether it's just not an option. You know, having worked with a lot of data for a long time, knowing that has been and I'm sure you all know, and Corey knows as well, that's kind of an issue, having large just buckets for populations that are very, very, very different. So I don't know, Anu, do you know if the data is being collected at all? Because like we've seen earlier in these calls and earlier with this situation, folks are just trying to provide direct service before collecting data, you know, about any populations. So is it a lack of collection, or is it that the collection is happening, but just in a way that's just too broad and not representing specific populations that might be overlooked when you just aggregate everything up to one continent, really?
So I think it is being collected, but notice on a lot of this, it'll say Asians, right? And when Asians comprise just over 34% of Bellevue's population and 40% of Redmond's population, Asian Indians immigrant community in Bellevue, the largest immigrant community in Redmond. But when you look at the roles, it's all put in as Asians. So a lot of times when I receive a different information, there are some surveys that are coming out where it does say Asian Indians or something like that, but I think a lot of work is needed on that. It's there's so many different languages in Asia, right? Like so many, and cultures are diverse, and they are very different. And more work is needed there.
Sorry. Capture the cultural. So that does sound, I know that the data is being captured, but it's just not truly representative of all of the different populations.
Yes.
Okay. are there any pluses? Do we feel that there are any things that are driving, the current state of individuals receiving telemedicine services up? Is there anything that making that better? We haven't necessarily come up with a baseline, but say the baseline again is below 50%, or it's just say below 50%. Do we feel if there's anything that's really driving that number up during this time? Anything that's making it easier for folks to get telemedicine services than before?
As far as counselors go, I know this is the first time that insurance companies have just basically opened the door that said we will cover counseling via Zoom. That has not been as abundant, and there is a concern about when will insurance companies cut that off for people. So because you used to have certain software and stuff, and with what's happened, they basically said, however your clients are willing to meet, we will cover the appointments, period. So that has allowed more people to continue getting at least, therapeutic care. And I think it's even helped the doctors that way, because some of the protocols have been streamlined to just help people get access. But when will that be cut off is the issue.
Right.
Do you know what they're doing for people who don't have technology?
No, I mean, I know like with, then you still have to go in. You can go in, doctors and stuff will let you go in, and you can make a phone call and still do a traditional appointment, but some people are afraid to do that. There are counselors who will meet face-to-face because they are essential, but again, some people don't want to do that. So that's the trick.
Yeah, it seems like it's really only working for people who have enough privilege to have the resources.
Yeah, you either have to have the resources to get online, or you have to not. And we're creating a culture of fear with all this. People don't want to go out. So then they might desperately need the help, but they're afraid if they go out, are they going to get sick or cause someone else to get sick? So it's an interesting dilemma that it does not have an easy solution.
I'm wondering, is there any data from the school districts about how many kids they have had to get laptops to? Because I'm wondering if it's going to extrapolate.
There was
that
last
data.
week. They had something like 4,000 or something.
Yeah. And I can we did get that data from Lake Washington. I can't say it's from everyone, but from Lake Washington, they were able to provide for their K through, believe it's K through 8, K through 6 or K through 8, because I think high schoolers are automatically one-to-one with access. They get it prior, but I can send, in the follow-up email, I can send out just the latest spreadsheet that I have with that data, because I think that's a really good point. And I also wonder how, and this is the question I'm asking to you all, how do we find out what is happening with folks who are not hooked up to the internet? I know, Kathy, you did mention that it's possible that they are delaying care. And do we have any connections or any thoughts about, talking to healthcare providers, talking to hospitals, or just, talking to anyone who's impacted? Like, how are patients being seen that may have health challenges, that do not have access to the internet at this time? And like you said, Kathy, are they going in? Or are they, again, just suffering in silence at home because they're afraid to go in? And I don't know. And I wonder who we can talk to validate that. How do we, figure out how many folks are we truly missing here, strictly because they don't have the access, which is an underlying challenge to all of the issues, a lot of the issues that are cropping up now.
I do have a friend that's a health supervisor at the UW, and what that means is she's over all the charge nurses and placement of patients, and she might be able to give me some basic information, but I don't know what she can or can't tell me, but because she's not in upper management, but she might be able, or her boss, who I happen to know, might be willing to talk to me. But that would just be the UW that could maybe give me some general figures that doesn't, you know, address Overlake or Evergreen or, you know.
I think that would be, even if it is general in UW, I think it is helpful, given that it may signify a broader trend that we could.
Well, and the UW does have a lot of, both UW and Harborview, and they are connected. They're UW, Harborview, and Northwest are all connected, as well as Valley Medical, and so they might have some demographics for all four of those, but, you know, especially like Harborview deals a lot with the homeless, more so than the UW. Because a lot of the homeless and transient population will go in there for services.
Right. Okay. I'm gonna mark you down here as an action planner then. So.
I will do my best.
Okay.
I can't guarantee my resources will come through, but I can at least tap into some.
The action movement is just the ask, not the get, just the ask. Talk to you, Deb. I'll put that for next week.
Sure.
We have about a minute left. Two things I wanted to see. I know Melissa, you're on the call too. I wanted to make sure that you got a chance to speak, and I know that Corey and Kathy for the past 2 weeks have summarized for us, and I'm not allowed to summarize anymore. So Anu or Melissa, would either of you be willing to give a brief 30-second summary of what we talked about when we jump to the full group? Hold on. Did I lose folks?
I guess I could. I'm still trying to figure out how I want to help with finding data for this, but I can summarize.
I think I will make a commitment too before of reaching out to whoever I can find at OSPI for data on how many electronics got into the hands of kids.
So basically our focus was on, I guess, the telemedicine.
We're going to close in about 5 seconds,
factor.
but
Okay.
I can send you this sheet for you.
Hello, everybody. All right, I'm recording our session, and I'm going to share my screen, which has our factor analysis funding. All right, are you able to see that document, everybody? Great, okay, thanks.
Yes.
Okay, super. All right, welcome everybody. It's good to see so many people. All right, so, and I know some people probably were able to join us in the last 2 sessions while we discussed this, but basically we're looking at, you know, thinking about East King County funding in general, and the group kind of did a really rough guesstimate of what that baseline is, and then the factors of what is kind of driving the state down, meaning we have less funding, or helping the pluses that are keeping the funding up in order to serve families. And then our focus population, I'm scrolling down, that the focus population of the Latino Hispanic population, those people, that population receiving funding in order to thrive. So those are our deltas and our pluses. I want to make sure that people received the document that Colleen, are you on the call?
Yep. Right
Awesome.
here.
Great, thanks, Colleen. You had, Stephanie had sent this out. Do you just want to talk a little bit about this document on the human services funding? Also maybe talk about, I noticed that it's from 2015.
Yeah, I'm sorry, I don't have it in front of me right now. Can you show it on the screen?
Oh, that would have been good. Let's see. Let's see, I'm not sure if I'm gonna be able to do that, but
Let me see if I can find it.
Should be in our emails.
All right. Let's see if I can try this a different way now.
I can get it on my screen.
All right.
Hold on.
Now, are you guys seeing the document?
Oh, I see it.
Okay. So this is the document that Colleen had shared with us. I will note that the data is from 2015, the general fund budget, how much is spent of that is spent on the human services, and then it gives a percentage. So we can see, you know, Bellevue, Kirkland, Redmond, Sammamish.
And let me point out, Kathy, because this fooled me when I looked at it at first, the percentage is per capita if they were at 6%.
Gotcha.
So it's not their current percentage. So you have in the middle here, percentage of general fund to human services, that column D.
Mm-hmm.
And that's really the only part that's comparable on a population, I mean, on a, you know, dollar basis. And then on a population basis, like per capita, I don't see a comparable number, like, you know, by percentage, so that we can see how one city does compared to another.
Wow, why is Issaquah so high?
Yeah, Judy, do you have a?
Colleen, can you say more about per capita if at 6%? Meaning
the whole general fund?
Yeah, 6% of the general fund.
Whole
And that's
general
a
fund.
number that was kind of not pulled out of a hat, but not really a number that people think necessarily is realistic for East Side cities. It's kind of more of a pie in the sky number. I think, you know, maybe getting everyone to 2%, and this is just my personal opinion, might, you know, we might be better off starting at a discussion. And I don't think anyone's going to these cities from the Human Services Alliance and saying, hey, you should be up at 6%, what's your plan? You know, I think they're just saying, oh, look at where you're at now, and, you know, what's realistic, how can you hold the line, what increases have you made recently, you know, that sort of, it's a little bit in the investigatory stage and a little bit in the relationship building stage, and in the, you know, kind of what should our aspirational goal be. So that's sort of the current state of the conversations that the King County Alliance is having, and it's having this conversations across subregions. So there's a South County group, an East County group, North County group, etc.
So if I understand you correctly, it would be column D. If column D were at 6%, then column H, that would be per person. Okay, got it. Thank you.
So can I ask a question about if we look at funding from King County, I'm just trying to get a sense for, this is funding from the cities themselves, but King County also provides human services funding. And do we know what percentage is going to East King County?
There are a lot of funders that provide human services funding. So there's philanthropy, there's the state, there's the county, and that is not the subject of this particular
okay.
set. I'm sure that data is available somewhere.
Okay, thank you.
Yeah, so as Colleen said, thanks Colleen, and thanks again for sharing this data. This is, you know, so one source of funding for, you know, our larger population of those who have need, and then our target population of specific Latino Hispanic families on the east side who need additional services. One source of funding is through, of course, the city budgets, and specifically their human services percentage. It would be interesting, and maybe to check in with those cities. I do see that Amy, I think Amy, you're with City of Kirkland, you know, to see if these budget numbers are, you know, still generally right. It is a little bit older, 2015 data, so it'd be interesting to see what the current data is. It's also interesting to think about, as cities have to do cuts to their budgets because of the effects of COVID, how they'll be thinking about their dollars that are going to human services. Does that spark anything else for others?
Well, I'm very concerned about budget cuts, state, county, city level, because everybody's tax base is going to be decimated.
Right.
Sorry about my cat.
So let's talk.
This might be a good time to bring up. So there's some really great work being done to base funding decisions on values instead of just looking at what had been done. And Colleen and I have been on some calls about that. There's a great letter that was completed by a group called the Washington Anti-Poverty Advocates Group. And there's also a little more progressive set of principles from the Washington Budget and Policy Center. But it's a way to look at how these, you're right, Janet, people don't have the money. There's not the revenue there to support what has already been passed in budgets, if we're even just looking at that little slice of the pie. And probably the same thing for philanthropy. Taking aside, these add-ons that have happened quickly because of COVID. So an interesting way to think about the funding, it's helpful to look at data like this, but to think about value-driven decisions. For example, one of them, and this has certainly come out on this call a lot, is to lead with equity, to not repeat the mistakes of the past. We've all brought up digital divide. And so it's not, don't cut human services, cut something else. It's more like, we have a great opportunity here to restructure the way we do things. And so anyhow, that's just kind of an interesting thing going on in the funding world now that people are trying to wrestle with. Do we change our structure? Do we look at all the things that have been brought up as weaknesses that the virus has exposed, digital divide we've talked about, language and so on. So anyhow, don't mean to muddy the water, but there's that work that's kind of going on with some groups to try to frame funding decisions, not on a scarcity model, which is what we're used to, the pie's only this big. It's more like, why is the pie only that big? Why do we do it that way? Who is essential? And how do we fund
it? This is Sue. Subha, I have a question. When we're doing that and looking at funding based on values or whatever, who is involved in those conversations? Is it sections of the whole community? In other words, is there a way that you get the business community involved and the social service groups involved and individual community people involved so that you don't run into the flack of, oh, this is a bunch of bleeding hearts? No, this is a different way to look at things. You know what I mean? And if you don't have everybody involved in the discussion, then you get into all this garbage throwing at each other. You know what I mean? So we have to find a way to have that discussion. And maybe it's when you're electing representatives, that's part of the discussion, but I don't think we have time to wait for that election.
Yeah, Sue's really correct. I'm wondering if there's some existing channel like Challenge Washington or other sort of table that's been convened already that is focusing on economic response and recovery that we could join as a way to ensure that principles like equity and not repeating the mistakes that were made when the 2011-12 state budget came out in response to the 2008 recession. It'd be great to have a human services voice at a table that is trying to stage, recovery plans that have private sector and public official,
Janet,
yeah, I agree.
Insight into that? Yeah, I was gonna.
Yeah, actually, I do want to talk about this because I realized when I threw out my question, I needed maybe a little context for the group. You're probably aware that when we look at our CARES and the 3 federal relief packages that came out, it went to individuals, it went to businesses, and it went to cities and counties over 500,000 population. So if you look at all of the East King County cities, none of us got any direct funding other than some CBD funds that I know Bellevue has already dispersed all of that money as of last week. So I think where I was trying to get to with asking about King County is that, right, when we look at King County, which is where some of the money went to, along with the state of Washington, we did get some money coming from the governor's office. We have yet to see what King County might be releasing in terms of funds. And when we think about the equity impact lens, King County has an equity impact awareness table. And if you look at where we are in East King County, and especially when you look at Bellevue, Redmond, and Kirkland, I'm looking at the table here. The worst city is Berrien at I think that's a number 8. And between Bellevue, Redmond, and Kirkland, we're either at a 0 or a 3. So what that means is that when King County is looking at their equity lens countywide, and they look at our cities on the east side, we are going to be seen as one that does not look like we have as much need. And I think earlier in the table, there was a comment in here about the fact that we may look like a community that is not struggling, but it's a misconception, right? Masked by perception of wealth and no need. Mm-hmm. So I want to bring this up because as we think about how cities can help, unless the HEROES Act passes and we actually get some direct funding to cities, as we've talked about, our funding, our revenue base has shrunk significantly from the B&O and sales tax. We are not getting direct funding ourselves. And it's not clear to me where when we look at the county and funding to support East King County for human services, where we're going to fall when the equity table shows that we are significantly better off than many other cities.
Janice, do you know what the table is based on, the 0 to 8 ranking? Is it per capita income? Is it percentage of need, perceived need in the population? Do you know what they base those rankings on?
I do have those here. They are looking at race, income, asset, poverty. So what I can do is I can find a link to this table. I just took a photo of it from a webinar I was at, so I don't have the link right in front of me. But there actually are several factors they look at to come up with this score in the table. And I think it might be helpful for this group to, take a look at what that looks like, because actually my photo's on, right? So I don't know if you guys can see this, but the lighter the color is, the less impact we have. And so if you look at East King County, we're almost all really light colored. And so that's why I'm just concerned about where we might be in terms of the support.
Yeah, Janice, can you tell me what the name of that table is? I'm just going to note that action item.
Oh, sure. Here, let me find my photo again. It is called the Equity Impact Awareness Table. And then there's a map that goes with that. And okay, it's from King County.
Thank you. Thank you. That would be great if you could share it. It's interesting as we're talking about all this is that really there's, you can think about it as there's 2 sources of funding. There's funding that comes through local, county, state, federal, so whatever those sources are. And of course that can be increased with some amount of advocacy to have more funding flow in general, but it still is that a little bit of that scarcity model because there's only a certain amount and everybody's advocating for it. Now I do take Janice's point really well, is that sometimes the East Side is seen as not in need, and it's really important for us to, share that we have need on the East Side with data. So thank you for that. The other area, of course, is around philanthropy. So money that is in people's pockets, and those who have could share. And so that's a little bit of the other side is around philanthropy. And that also has to do with getting out what the need is.
Kathy, before we leave cities and turn to philanthropy, I'd like to just remind the group that we talked a little bit about banked capacity, in taxation on East Side cities, and how a lot of East Side cities pride themselves on being low tax, and that property tax is a much more stable base than sales tax in this current crisis. And a lot of cities have the ability to increase that base if they chose to do so. Whereas philanthropy is much less elastic in terms of, you know, untapped capacity, and is only about 5 to 10% of total human service funding, whereas 90 to 95% of it comes from the public sector. Most of that, of course, initiates at the federal level.
Thanks for sharing that, Colleen.
I just wanted to sort of bring up a point in regards to the perspective of like community-based organizations and those that focus on priority populations. So just from a perspective of receiving funds and just during this COVID period, the amount of reporting. So many of our agencies, and we're a mid-size agency, a nonprofit agency, you know, is trying to secure funding, but also in the meanwhile doing direct service. So trying to figure out what the needs are, but then the accountability of having to do multiple reports, you know, the usual reports, and then the revised plan of action, and then just having that, I think, capacity to be able to be the advocate for our community needs, but in the same token, ensuring that we're reporting what we are doing, and yet at the same time doing that direct service. I think there has to be some sort of maybe systemic, as people were talking about equity as a priority, maybe priority populations. What is the accountability of funders to really sort of have that systemic analysis? So rather than us trying to chase the fund and prove that we are worthy, more about agencies or funders saying, hey, listen, we know what the needs are, we've done our research, we see the demographics, how can we help? Or how can we burden the, lessen burden the systemic barriers that your community faces? And how do we work with you? Because I think that's just a different mindset in terms of working rather than that scarcity model as you were talking about and competing. Because I think when you ask us what our needs are, we work from 0 to 100, and the barriers are sort of intersectional. And so as we, you know, there isn't anybody to be able to represent all the time, but it would be nice to sort of have a different model of funding where it's like, we understand that there are systemic barriers. How can we have this fund, we have these priorities, how can we support your organization to deal with these systemic issues?
Thanks, Helen. So you were really lifting up that the reporting requirements can sometimes be, you know, this burden, especially if there's no universal reporting requirements, right? So a little bit of that might be more towards, you know, kind of a funding table, both government and private philanthropy, to kind of come up with something, to understand they're each asking for something different, and that's a burden on the organization. That's great. Thanks for lifting that up.
Kathy, I found that table already. I'll put it in the chat box.
Yeah, it looks like Janice did too as well.
Okay. Yeah, and I have to drop off, so I wasn't sure if I should just put it in the broader chat box. So I just put it in there for you, Kathy, and you can
That's
share.
Great. Properly. Yeah, I'll add it onto the document. Thank you, Janice.
Yeah, thank you so much. I've got to drop off for another call. Really appreciated having this conversation.
Great.
Thanks.
So there, we only have about a minute and a half, but you know, so we're basically talking about, and I think we've really gotten a lot of factors on the sheets on both the overall population and the priority population. What's interesting is, you know, is where to go from here with all these factors, and to try to better understand about how much funding is needed to be able to serve. Like, what is the unmet need in funding on the East Side? Colleen, I don't know if United Way has any data on how many individuals are waiting for rental assistance on the East Side, if you're breaking it down in areas.
I can check and see what I can find out. and I'll let you know. So you can put that down for me as an action step. I also thought I heard, and maybe I didn't, but I can check with Helen, that she might have been saying it would be great to have funds that were focused on people with multiple needs or that intersectionality, that maybe funding could prioritize how impacted people are, so that there's a higher priority on people who have multiple barriers or that sort of thing.
Kathy, can you also add in the Delta driving things up, values-based conversations about funding structure?
There we go. How's everybody doing? I see we have Paul and Laura on. A small but spirited house.
We're doing good. How are you?
I'm doing all right. So before we dive in, one quick bright spot from your long weekend.
Oh, goodness. Oh, being able to go paddleboarding on Sunday because it was nice weather.
And where was that at?
Just over here in Lake Washington and Bellevue.
Oh, okay. Was it crowded?
No, actually, I mean, there were people on boats, but it's easy to social distance that way.
Right.
There were a few people on paddle boards, but it wasn't bad. It was almost like waves of people knowing when to go and knowing when to get out.
Cool.
Yeah.
Cool. Paul, anything to share?
I was trying to think about that. Nothing as exotic as paddling, but I would say sleep.
Sleep, that's a good one.
Oh, that's a good one.
Yes, did a lot of sleeping.
Very fun. And I myself had a great Zoom call with the family on, I guess it was last night actually, which was fun. And then some deer showed up in our yard, and every year we see like the babies, but this was like a little like just tiny little spotted fawn.
Oh, a little fawn.
Yeah, just basically wanted to just drink mom's milk, and so that was cute. So I guess that's two highlights, but hey, take them where I can get them.
Exactly.
Okay, so factor analysis. Do you guys have any question? We went a little deeper into that today. Sandy did and such, partly at my request, because I want to make sure that people didn't feel like we just dove into this a couple of weeks ago and didn't really have an understanding of what they were doing and why they were doing it. So we're doing these factors analysis now based on these three focus populations that came out of the feedback from the group here.
Mm-hmm.
So we're going to do these factors analysis, and then so those are the groups. Here's the baseline. We just picked a number till we can validate that. 50% are having their basic housing needs met right now.
Mm-hmm.
Reasons why, based on our own kind of just experience or assumptions, are this is what's like depressing that number, right? And down below are what's the upward pressure keeping that from being worse than it is.
Okay.
So the idea now is to take a look at these, see if they still make sense, and then again, rather than, right, because I use that word assumption, that's really what they are for now. And we shouldn't be speaking on other people's behalf. So the next step is to go out and take some action items to go validate these assumptions with the actual focus groups or focus populations that we have here, right? And again, I think what I like about this equitable results series is that it acknowledges you can't sometimes boil the ocean, right?
Mm-hmm.
People, they try to do it all or do too much, they get frustrated, and they just kind of basically give up or reduce their efforts. So if we feel we can't do this for all of these populations, we can decide right now in this breakout team if we just want to take one to focus on for now, right? And then build on those successes. So the idea is focus population, assumptions about what's driving the current state, And then out of this meeting, we should probably have some action commitments to go out and validate these assumptions, so that then next step is to, after we've validated these assumptions, then design some strategies and tactics to address those factors, because they're no longer assumptions, they're now like validated factors.
Mm-hmm.
That would be the next step that we move to. Does that make sense to you guys?
Yeah.
Okay.
I got that. Actually, I wanted to share a little bit of insight because Peyton had put up like a small chart and it had a lot of missing numbers in there.
Right.
And one of the ones that caught my eye, because this is what we mainly work with right now, being that our offices are closed, is for rental assistance.
Mm-hmm.
And to give you guys just a little insight as to how many calls we've received. So I can't really say calls because we're working from home, even though we do have a temporary work phone, but whether it be calls, emails, or referrals from the Bellevue School District, we have received 178 calls since March 16th for rental assistance.
Wow.
I'm sorry, how much again?
178.
Okay.
And like I said, these are a combination of referrals from the FCCs in the Bellevue School District. These are also clients who have already received some type of assistance from us, and just new clients who probably, you know, went on King County's website or City of Bellevue website and saw that we were an organization that was offering up rental assistance. Now, although we have received 178 calls, our organization, our services are limited to Bellevue specifically. So Bellevue families who live within a certain zip code range, because we also serve part of Redmond, because there's a school in Redmond that's on the Bellevue School District border.
Okay.
And, you know, out of that 178 to date, since that March 16th, we have helped about 52 families with total rent. When I say total rent, though, it's really base rent. So we unfortunately do not help with utilities. We do not help with excess payments like pet rent or storage or parking. But we do cover their total base rent, which you can imagine can be quite a sum. I think the highest amount we've ever covered to date, which is actually not normal for us, is $2,900. And
Rent.
that's for 1 month. Yeah.
Yeah.
For 1 month, $2,900. So what we're seeing is not only, you know, a surplus of families who are just really in dire need of help, but, you know, with this whole pandemic in place and having to follow rules of who is non-essential, who's essential, and then based on the phases, who gets to go back. But does that mean they get to go back fully, or are their hours still capped at a certain amount? And then we're also dealing with people who are self-employed, whether it be they are photographers or, you know, they have their own contract business.
Right.
The biggest one I think right now is actually Uber and Lyft drivers.
Mm-hmm.
And, you know, a lot of it is, you know, kind of hard to swallow. And I'm not sure why, because it's not like I haven't done this before for them or helped. I think it's just seeing now the amount of people who are impacted and at what level.
Mm-hmm.
And a little backtrack on that too. I mean, yes, our highest rent so far that we've helped is $2,900, but we are used to only giving out rent for at most $1,200, $1,500. That's usually our average. So the cost of living compared to unemployment or other government assistance or side jobs that people have had to take or odd jobs that people have had to take for this, it's really starting to mess with them, you know, not just financially, but mentally. And, you know, I've gone from having people asking for help to pleading for help.
Mm-hmm.
And it is still very hard to swallow, and we definitely do our best. I mean, every person that reaches out to us, they do get a response. So we make sure that we either are able to get them into our program and help them, or we refer them to the programs that we know are running. So coming to Eastside Pathways and hearing the organizations that are still financially able to assist families, continuously going to the City of Bellevue website and the King County website, and I refresh it every day to make sure that you know, an organization wasn't added, or maybe something was taken off because of funding, and just making sure we have what we can give the most up-to-date information to these people, because I mean, they really are looking for any kind of help.
Right. Laura, do you have this information disaggregated at all by, or we could look at this based on our focus populations here, or even by race or by anything?
So families needing rental assistance, that would be the 178
right.
total. The undocumented, unfortunately, we do not have that. We can, I mean, it would take me probably until the next meeting, but I can figure out based off of ethnicity. I think I can do it.
Okay, and the reason that that's important to try to disaggregate that data by race is, right, one, the whole racial equity lens that we're looking at everything too, and I think it will also help them design more effective strategies and tactics.
Correct. I can tell you this, definitely more than 60% of the 178 people are Spanish speaking.
You said 60%? More
than 60%, correct.
Where's that greater sign? There it is. 60% Spanish speaking. Okay. All right. That's awesome. That is good data to have, right? And we basically, we just go out and talk to people, and they tell us that, I don't know, so go talk to that person. That's how we get this data sometimes.
Yeah, we actually, our intake process is very strenuous, I think, for both parties. We require a lot of documentation, and from that comes a lot of explaining. And sometimes they are willing to do it, and it's just really easy. They kind of give us every answer we need from the get-go, and then other ones, it's a little bit like pulling teeth. And we've kind of attributed it to the fact that, you know, they probably think that we're sharing their information with other organizations, or they're thinking that, you know, we're digging too deep because we're trying to nail them for something.
Yeah, trust is a problem.
Yeah, so it's, I mean, some factors that we've since March had to include into our data pooling for ourselves is, you know, finding out what their actual employment status are. You know, are you really out of a job? Or are you just are you laid off? Are you furloughed? Have your hours been reduced? What does that look like? We've also tried as much as we can, and actually it's fairly easy because of one of our required documents. We document what their industry is. So we can see the level of impaction that this whole pandemic has had on, you know, restaurant business, contractors, entertainment, health and wellness, whatever it may be.
Excellent. Very good. Paul, is there anything that action items you can take, you know, maybe for the next, whatever, next meeting, 2 meetings, whenever, on any of the focus populations to try to validate some of these factors?
Unfortunately, not based on the way I think of, no, I don't think on those 3 population groups, no.
What could you do?
See, I think the thing that I could do is, I mean, I could follow up with Alex on some of those things, but
okay.
Other than that,
and that's okay, right?
Yep.
Just Alex, give me something to do. Point me in the right direction. And remember, I know that Sandy had mentioned in your role, but you can also step outside your role as well, right? And see, you know, just make some calls, send some emails, see if there isn't any information or people that you can talk to. Hey, do you know somebody in one of these groups that I could have a confidential conversation with to validate some of these
Yeah.
factors? And I think that these bottom ones are just as important as the top ones, right? Because if these are things that are working, what can we do to support those, or you know, spread those more widely, make those more impactful?
Yeah, I think the question that you'd started asking, Joe, was the target groups. Do we want to spend time on all three, or do we want to narrow it down? I think you'd asked that question. I think that's what, maybe I imagine you were saying that, but did you ask that question? I guess let me.
Yeah, I mean, that's up to you guys, right? We certainly have a good resource for families needing rental assistance, so we can just focus on that for now. Uriana's not here; she might be able to help us with the top one, but she's not.
Yeah, because I'm not sure, and I guess Laura, in your from what you just mentioned, when you talk about the families and the calls that you're getting, do those families broadly fit into, I guess, all three bullet points?
Right.
Or is it, would you say they're more skewed towards, because I think you said 60%, you said most of folks are FCC, families that you already know of. So I don't know. So just curious.
No, I don't think that they're like discrete, necessarily separate things, right? If you were to draw a Venn diagram, it would look there'd be a lot of overlap and such. So, and again, the whole idea of the target universalism that we follow is that if you helping one group, you know, the group closer to the yolk, as I call it in the egg diagram, right, tends to help the outer circles as well as you move away from that focused population. One strategy, helping the strategies for those tend to be have a universally positive effect. So if we just want to focus on families needing rental assistance, that's great, you know. And again, let's then take a look at you know, this bottom thing. What can we do? Can we validate that, you know, what creative ways are people coming up with? What type of mutual support is it that is keeping that number from being even worse? You know, what does that advocacy look like, and how can we support it or give it vitamins?
One thing that we've noticed especially in speaking to just the Spanish speaking community, they are very receptive if you respond to them and not necessarily have an answer for them right away, but if you're able to give them anything, even just a resource, they like that because, and I think I can speak on behalf of all the clients, that they just appreciate that when they reach out to us, we do our best to get back to them that day. And I think we do usually. And we have like these list of resources, and we kind of break them up depending on what they're asking for, because we don't want to overload people. So we have these small lists on our sticky notes within our desktop. And if they're asking for financial assistance and they don't live in the area, then we have these list of numbers and organizations that we can give to them right away. Same goes for food, same goes for utility payments, same goes for clothing. And it's worked out really well because, not to say that they couldn't do it themselves, but like, what was her name? Liliana was talking about, there's a barrier with technology. And so some of them may know that they can Google or that they can look it up, but they may not know how to. They may not know the words to Google, you know, and they kind of get stuck. And so having things like that prepared to just shoot off right away to them, it works out well for us too, because then it gives us time to retreat and kind of collect ourselves, to make sure that, you know, we are reaching out to everyone that we need to. And if they return to us because, you know, they weren't able to get a hold of someone right away, or maybe they just figured out, you know what, we're going to try your intake process. You know, we want to see how far we get. We want to see if we can actually qualify. Then it gives them two kinds of hope, you know, one of them being they may qualify with us, and the other one, hey, I have these backup organizations that I can reach out to in the simplest, most available form. You know, they don't have to read anything. They didn't have to go anywhere. It's a quick bullet list of just organizational name and phone number.
Mm-hmm.
And I think that although that's on a smaller scale, you know, it's nothing like the postcards that they were talking about sending out and that they have sent out to different cities, including Bellevue. But, you know, the quickest thing you can do sometimes is just bullet points.
Sure.
And make it real simple. And then they really just don't feel like they were kicked to the curb, you know, and we kind of just brush them off. It's, you know, we need to evaluate something, but in the meantime, these are organizations you can reach out to, and they usually do.
Yeah, I think people respond really well to know that they're actually being heard, you know. Mm-hmm. Just communication, right? Cold Stone Creamery, that's their acknowledge every customer that comes in, even if it's super busy, which is great because that keeps you from walking out if you're busy, because they know that.
I get it. I mean, it's hard. It's hard to keep up. I mean, myself and my coworker, there's only two of us working in human services. Mm-hmm. And as you can imagine, you know, between actual phone calls that we get and emails, we try to answer them as soon as we get them, because we just don't want them to feel left out, right. Or that no one is getting to them, because we have had clients tell us we cannot get a hold of anybody. We have not heard back from anyone. We were told that they would call us later, and we're like, okay, you know, unfortunately though, that's not something that we can help, right? But we can try to help you right now here with us.
Yeah. Yeah, I know. Sadly, in general, I'm always shocked when somebody gets back to me, right, about anything nowadays.
Yeah, it's a lot. It's a lot.
So, all right. So we have about 30 seconds. So I know that when we come back, Sandy, I don't think they're going to go by focus group this time. They're just going to ask for general call outs about any commitments that people have made. So if one or both of you want to go ahead and do that, feel free. If not, I will send out a recap of this and this document, and I will see you next week.
And so just to be clear, our action is to just continuously get data, correct?
Data and validate these factors.
So we have Josefina, Lindsay, Helena, and Narima with us. I can't see our participant list. Have I listed?
Tammy's here, yeah.
Okay, we have Tammy here. Excellent. So what we are trying to do today is come up with a baseline number. And like I said in the last call, I know that this is an approximation, and it is tough for some of us to put a number, but it's really important for us to review and look at the work that we are doing. As we get more data, we can come back and refine this number. So today on our call, Peyton shared, what does 100% of King County really look like? So keeping that number in mind, and I don't expect you all to remember the number, but then keeping that number in mind, what would we think is the baseline for food? What percentage of people in East King County do we hope will have accessibility to food resources? And when I say that, I want to keep in mind, there is the ideal state. We want to say 100%. But realistically, given the access that you have to the information, what percent might you think is a good number to start off from? Helena, I guess you're on mute. Oh, I thought Helena was trying to speak up. Are there any numbers that are coming up for folks?
Sandy, I really think what we're trying to do is we're still trying to gather the data.
Mm-hmm.
And I think that's going to help us to figure out where the gaps are. and we're doing our best to gather the data, and I don't really have a feel for it yet. Lindsay, Helena, I don't know about you, because we tried to gather together a spreadsheet regarding food resources. And as I put in the chat, Sandy, I think that the people who are doing the work on the ground, they really don't have a lot of time to be able to plug these numbers in that we need to know. I'm not sure if Lindsay.
Yeah, no, I agree. I don't think we have a lot of data. And I think, unless I'm wrong, Sandy, are you saying like based on our best guess?
Yes. So this is a guesstimate. And that's exactly the point that I was trying to make. Tammy, I completely hear you. We do not have enough data, but this is an iterative process. And there will be the opportunity to keep coming back and refining as we get data, but we need to start somewhere to say, okay, so maybe 60% of people in East King County, that's what we are working towards. But as we learn from data, we say, you know what, I think a lot of the CBOs are doing a great job. Let's put in 70 or maybe 45. So we will have that opportunity to come back and refine this. But I would really encourage and invite each of you to give me your guesstimate.
Well, I think before we can give you a guesstimate, Sandy, I guess the question that concerns me is that with the data that we've been collecting, we've been asking about apples, and what you're asking for is oranges. So we have been talking about how many meals, how many grocery bags, how much food have we been distributing, which is a different set of numbers than how many people are without food, because it doesn't mean that everyone who's without food is showing up to one of these sites.
Absolutely. Now, and Helena, you make a great point, because that would move us into the focus population, right? Remember, I just spoke about, we have the technical, there's a need for food and there are resources. Given that information, how much does it seem like should be served? And as we move into the focus population, we are saying, oh wow, so there were 100 people who needed it, we had 100 food packages, and only 80 got picked up. And that's when I hear your voice, Helena, from the last call when you said, people said cost of gas. And Tammy, your voice to say undocumented families are experiencing fear and anxiety. So at this point, with the resources that are available, what percent of people do we believe might be a good enough judgment of those that will be served with the food resources that are available? Does that answer your question, Helena?
Well, yes and no.
I know. This is always tricky. The baseline is tricky because you don't want to put in a number when you don't have enough data to back you up.
Well, I think what I'm saying, am I looking at the population of what's in East King County and then making a best guess estimate? Or am I looking at those specified populations that we said that we needed to focus on, and asking the question of those populations, what percentage of those populations are not having access to food? It just gets, I don't want to make it more complicated than it needs to be, but I'm trying to say something that is more realistic than...
I hear you.
So maybe, I think I understand, like, we're all feeling really challenged by this, and the goal is to try and put in a number that at least we can like work from. I'm sure there's going to be a revision needed of that number as we learn more. And I'm also struggling with this, like what's our baseline for this baseline, basically. So I'm thinking that, like, even under normal circumstances before COVID, we knew that there were 158,000 people in North and East King County. This is like HopeLink's data. 158,000 people who made under 300% of the federal poverty level, which by our best information, that means they probably needed food assistance.
Mm-hmm.
So that's 158,000 people within that service area, which includes Redmond, Bellevue, Kirkland, Carnation, and Shoreline.
Mm-hmm.
And we're seeing about 3,000 households, a week.
Right.
So it's a drop in the bucket,
Mm-hmm.
as far as we're concerned, of people who could potentially be needing that help.
Mm-hmm.
So if we just went on that, I don't know, like maybe that combined with school resources, combined with the other, the food trucks and the home deliveries,
Mm-hmm.
I don't know. I guess I would say maybe like 20%. We're serving maybe 20%, and then see what people think about that. It's a pretty, low number. Doesn't look great, but I'll throw it out there.
Lindsay, I appreciate you saying that, because the thing is that there were some numbers that Peyton shared at the beginning that I think we really need to pay attention to. And that is the number of Latino and Hispanic. Our population is considerably large. And if you just have conversations with Renewal Food Bank, and you have conversations with the food trucks, and you have conversations with the family connection centers, you're going to see that that's a huge percentage of people who are seeking out that food. But if you were to take a look at the data and say, okay, so nutrition services at the beginning of the school year had, out of their 20,000 students in Bellevue School District, 3,600 qualified for free and reduced lunch in September.
Mm-hmm.
Yet, if you look at the numbers of people accessing that food, the free food, only about between 1,000 and 2,000 students are accessing that food. Where are the other people getting the food?
Right.
And that's data right there. So I don't think, I agree with Lindsay. I think it doesn't sound good, but I think she's pretty close with that, with about 20%.
Well,
Helena.
If we took let's say we took the 3,600 free and reduced students, and we just said, we expanded that and said 3,600 households, 3,600 families.
Yeah.
And we took the 3,000 that Lindsay mentioned.
Per week.
Yeah. That brings us to 6,600 families. We'll just say 6,600 families. But my concern is that, Lindsay, we would still need to pull the Shoreline numbers out of that. I don't know what that looks like in order to get to an East King County number.
And there's no way to know if this is duplicative either.
Right. And that would be, I would say, my first attempt at a best guess answer. If you took that 6,600 versus the amount of population stated in Peyton's data as the East King County, to begin to look at that number, but I'm still thinking that my logic is off. It doesn't feel solid to me.
I'd like to invite the others to, how does the 20% land on you? And this is for all of East King County. I also want to remind you, I know that some of you did not join us in the last call. We also have the focus population. We will be specifically talking about the bilingual English learner families in the next section. At this point, we are saying everybody who needs food in East King County, what does that percent look like? Linda? Any thoughts from anybody else?
I keep thinking about, I know that there's the language barrier, but they were talking a little bit earlier too. I'm finding that the technologically challenged, some people are, the teachers are coming to their homes, doing different things like that. And but I think communication is still a difficult thing, and I know it's something you just can't get over. I know everybody's trying, but that's where I get kind of stuck, is how do you find that number? And the other thing is, I sometimes think that people are buying food because that's critical. So what's that doing to their rent issues? What's that doing to other things? And are they going to other family members who may be on the verge of struggling and, compromising them? So just kind of an outreach thing. So I don't have any basis for the percentage that you're talking about, but it's that missing number that you're not sure of, and I don't know if we can get to that.
Right. And that kind of gives me a good segue into, I'd like to take about 30 seconds reviewing the focus population that each of you listed for food. And I'd like to spend the rest of our time really thinking, in your role, in your organization or in the community, what action commitment can you take to bring back numbers to our calls? And how can you reach out to focus population, anybody from this list, leverage your relationships so that you can share these factors with them to know, do these factors make sense or is there more? How would you prioritize these factors as we go into strategies and tactics? Yes, Tammy.
So I'm not sure if this answers this question well or not. I used the media on Friday and got onto Cairo with a Nourishing Network and food truck partnership. And that went out there. So I'm kind of using media in that way. And I also made a connection with someone who is checking with Jaime Menendez. And hopefully we'll get a story on Univision about food resources in Bellevue. Because that's basically what I'd like to do is get that out there. So that's my action commitment, is working on that this week to see if I can get an interview with him.
And I can, the city collects data in all kinds of shapes and form. So not only the human services needs, but we have a whole division that really just looks into all kinds of data and demographic questions. And I can go back and ask both entities, the human services folks and our data demographic folks, to see if this question has ever been posed to them in this way, because and see what kind of numbers we would get, or if not that, how would they logically come up with the solution to how we could obtain that kind of information in a solid basis.
I'd like to stay with you for another moment, Helena, and speak to, when you think about our focus population that we listed, who can you reach out to in order to validate these factors?
Well, I think not only do our human services folks look at these type of issues all the time and does a 2-year report on it, but I just recently worked with Peyton on a different project where we looked at the human services needs assessments from a wide variety of data sources in East King County. It included Hope Link's needs assessment. It included Overlake Hospital's needs assessment, and several of the municipalities who all do human services needs assessment. So there is a wealth of data out there. It just we have to find a common ground as to how to answer the question particular that we're talking about regarding food and focused populations. So there is data out there. We just need to be able to have the time to go through it and comb it and have the people who have the right expertise be looking at the data.
But I'd like to, Lindsay, Josefina, the others can we just go around like a round robin and maybe speak? Yes.
Yeah, Sandy, could you scroll up? Can I see the target population?
Sure, I'm sorry.
No, thank you. Okay, I screenshotted it if you need to scroll back
Excellent.
down. One thing that's coming up for me is particularly around populations who may be experiencing homelessness, and we are going to need to find an alternate solution because we've been partnered with Microsoft until recently. They've been providing ready-to-go lunches, and though that program has since ended, and so we do have other services that are essentially no cook, like emergency bags available, but the missing link is advertising that information. So how to do that and make it clear, I mean, part of our hesitation has just been it's just we don't know how long we can provide this. And so there's been hesitancy, but how do we know that it's unknown and still move forward?
So the specific population that you're looking at is the homeless population?
Yes.
Who else would like to add on? Feel free to unmute and...
Hi, this is Carl.
Hey, Carl.
Hi there. I'm with Bellevue Police Department, and I specifically chose this breakout group because we, the police and fire department, wanted to do a food drive, and our public information officer was having some frustrations where some of the nonprofits were only specifying certain types of food. And so I would love to fill one of the rooms on the first floor of City Hall with food from all of our shifts in the police department and from the fire department. And hoping that there would be a provider that some of you all might know that would be willing to take that food. And then a second idea, specifically for Lindsay or for anybody else, but we have an ample number of police officers and the call volume is significantly low. And would it be possible that we can, during free time, make some food deliveries or even prescription medicine deliveries? I know the police departments in Oregon have taken that on and it's been very, very successful. But the community has given us such a tremendous outpouring over the past couple of months since COVID-19 has affected all of us, and they've donated PPE and dinners for us, and we'd just like to give back.
Wow. Carl, I would like you, the first point that you made about making different types, did you mean different types of food? So keeping in mind the sensitivity that people have, cultural and other sensitivities, can you specify the first point again, please?
Sure. This would be non-perishable food, bags of rice, fresh bags of rice. I might add, we're going to be clearing our cupboards at home to get rid of the stuff that we don't want anymore. This is all fresh stuff that we as police officers and firefighters basically stockpiled away for our families in case there were disruptions in the food supply. So we have ample non-perishable food that we would like to donate to whoever.
Super.
Awesome.
Lindsay, what's going through your mind? Because there's a lot.
Yeah, so much.
Carl.
Carl, thank you so much to you and your team, and certainly any guidance that you have received regarding specific kinds of foods is due to the fact that we are providing a very specific box that we recognize doesn't meet everybody's needs, but does have a variety of items, and we just want it to be equitable. But we do know there are other food banks that are accepting all donations, and I'd be very happy to connect you with them in case that's more in line with what you are looking for. Yeah, so I can talk with you offline.
Thank you.
Yeah, 100%. And also, I just have a follow-up question real quick on your second point about your team volunteering for deliveries. And I'm curious if I guess one like potential concern from us is if an officer arriving in uniform could potentially be traumatic for somebody who just, you know, is from a population who has concerns about law enforcement. And I just want to kind of confirm that that would be the case, that they would likely be in uniform.
Sure. So likely.
Did you all lose Carl as well?
Yep.
Yes.
And I'm just spitballing on the wall here just because I've seen in Oregon face-to-face contact. Necessarily, we would deliver the food or a prescription to the home. We wouldn't leave a prescription unattended at the home, but we would go back to our patrol car and call inside.
Hey everyone, welcome back. I hope that you all had a good discussion. We were in between hours when we got pulled out, so I'm sorry for that, team food. At this point, I would like to invite a few folks to really unmute or use the chat box as well to share one action commitment that you made to follow up with a focus population on the factors, or one action commitment that you made to really look at your sphere of influence and bring back numbers and data. Feel free to unmute.
This is Narima Amin from Global Social Business Partners. I haven't been able to speak within my group, but I would really like to connect with HopeLink and connect with Nourishing Networks and see what data I can provide based on some of the food we've been providing on the east side. And in addition, in building the youth infrastructure for providing more access, we're working towards getting a food truck to be able, again, to see how we can plug in with Nourishing Networks platform. And so I'm all about collaboration, and I'm all about figuring out how to get the data to folks that need it, especially Nourishing Networks. It's talking about getting data. I think we have a common board member, so I would like to work through that board member and see whatever information I can provide there. And also working on our own infrastructure for getting more food into the Bellevue School District centers. They said potatoes has been a big thing for them, and they really, for all cultures, it was just a big hit. And so again, getting the data and doing more so we can collaboratively to get more food to the population that needs it.
Super, thank you so much for sharing, Narima. I also want to remind everyone here that we will have this forum open for the last 15 minutes. It's going to be unstructured time where you will have wiki. So if you need to be sent into a breakout room so you can have a one-on-one, feel free to stay longer. Thanks for sharing again, Narima. Anybody else that's willing to unmute and share on your action commitment?
This is Jamie Bonnet with Kids Quest Children's Museum, and I was in the remote learning discussion, and we had lots of discussion around texting and how to continue to communicate, especially with our Spanish population. And there were lots and lots of different action commitments made around this. There are people looking to think about the process for getting permission to receive text messages. That was a big discussion. So people are signing up and then they're not seeing the text messages. So different people are going to be looking into and working with their communications department to figure out if they're getting these using the text to get the texting, or if it has been put on the back burner. They are working, Shamari had offered up a new app that the Bellevue School District is looking at, and it's called Talking Point. And it's a platform for text services that has translation built in. And so it's a free app. It has limitations, but you can purchase in the app to communicate more. So that's something that we wanted to share out and let people know. And then one of the things that you might have just seen Liliana put in the check box, but HopeLink is looking to connect with Bellevue School District and Lake Washington to share successful ways to connect on text. and if they can be using them at food sites and other spaces. But there was a lot of conversation around texting and how to effectively communicate.
Super. Thank you so much for sharing from your team, Jamie. I also see that Laura from Bellevue Spring, who is a part of the housing group, has shared that they all took an action commitment to continue to actively collect data to make sure that nobody's left behind and everybody seems seen and heard. Melissa, I see that you've raised your hand. Feel free to chime in.
Hi, my name is Melissa from the city of Kirkland, and my group was on health and well-being. Today we focused on what factors are driving telemedicine services up, or what could be hindering that for some demographics.
Mm-hmm.
So I would say that we are still trying to figure out like how would we measure that data, because there's just so many different aspects that would make it difficult to find that raw data right now. Mm-hmm. And our big action commitment for from discussing today would be, we're going to have one of our members talk to UW Medicine and maybe get some data from OSPI on just to kind of get the different factors to see what could be contributing to that kind of service, and if it's, you know, access to the internet, and is the information being collected for different demographics mm-hmm. on versus others. So we're still kind of collecting all of that right now.
Excellent. Thank you so much for sharing, Melissa. As we move along, I'd like each of us, I hear that there are some robust conversations that happen and action commitments got listed. Each facilitator will be sharing our notes from our breakout rooms with you. So hold the focus population as you work on reaching out to whoever that you can in your sphere, and also bring in the data. Like Peyton said, we need numbers from you so we can start building that out in each of our focus areas, the performance measures. So thank you so much. With that, Joe, could we please move to the next slide? So the toolkit is what you can access in the Google Drive. You also took a poll on this specific question. We have the gracious space that helps us build the container, the data walk. You all have been participating in the factor analysis, bringing data to the performance measure. We've been sharing the community engagement spectrum with you to really know where you're at as it relates to engaging with the focus population, holding the racial equity and the adaptive leadership lens as we work through these different phases. The accountability pathway is a tool that really, I keep it with me just to know where I'm at and how I can take that one step to move to the right. All of this can be found in the Google Drive in the follow-up email that Joe shares with you right after every call. With that, if you do have any questions and if you want to reach out to any of us, this is our contact list. Feel free to reach out to us if you have data, any questions on what we spoke about, the equitable results. Also stay in touch with your focus area group so that you can hold each other accountable and share information that you're collecting. I'm excited to see you all next week. And with that, I will hand it over to Stephanie to close us out today.
Thanks, Sandy. I just wanted to say once again, I appreciate all of you in sticking with us in this work and sticking together. The individual action commitments are really, really what drives this work forward, taking the small steps. It doesn't have to be anything huge. It could be, again, I want to remind everybody that the information is available. Be sure and share it. Share it with others in your community, in your neighborhood, in your organization. make sure that you're having those conversations to validate what we're talking about in these larger groups and in the focus groups. That's really, really key. And make sure that you're coming back together to be able to share with each other what those action commitments are. I really, really appreciate you staying in this work together. I know it is exceptionally challenging right now. And as I said at the outset, I think that folks are getting weary for lots of different reasons, and hopefully folks will find inspiration. I saw a lot of people talking about community, and hopefully you'll find that inspiration to stay in the work because we're doing this together. So thank you again for being here. I want to open it up and invite one or two folks just to share one word about a description that describes your experience in this meeting to close us out. And you can put it in the chat too if you'd like to. One word. Motivating. Thanks, Peyton. Movement. Thank you, Helen. One or two more. Informative. One more. Anybody want to unmute? Somebody can close us out with one word. Leave us with inspiration.
I can add, sorry y'all, my video is not working. I have bandwidth issues. But I'm Mary, I'm over at HopeLink, the director of EDI, and I would definitely have to say collaboration. I think that's one of the things that's most exciting about getting to jump on these calls and this week, start my week with you all, is just getting to think about the many, many ways that we get to collaborate with one another.
That was fabulous. Thank you, Mariama. I so appreciate that. And remember that we will be continuing these weekly calls until early August. And we'll also leave open space for deeper dives that we'll be announcing along the way as well. So until then, we will see you next Tuesday at 10 a.m. Until then, be well. Take care. Bye-bye.